Obsessive and compulsive personality disorder is basically this condition where someone has a pattern of behaviors over time that they're very rigid, or maybe they stick to a schedule or have a certain routine. And if something goes off kilter, they may get a lot of tension or anxiety or anger, and it just makes them very uncomfortable. So not everyone's going to meet criteria for a personality disorder, but more people may have just obsessive compulsive personality traits. And those are just little tendencies to act this way during times, like during times of stress or busy times in their life. And I just want to separate that from obsessive compulsive disorder, where you have obsessiveness, like recurring intrusive thoughts that impact daily life, or compulsive behaviors, which is repeating behaviors over and over again because it helps ease some of the tension. So obsessive compulsive personality traits can actually be a helpful thing for people in their everyday life. Take, for example, people who need to be very into details, like for their job. Maybe it's an accountant or a doctor or an engineer, like building a building or a bridge. Like, you really want to pay close attention to the details so that everything goes everything goes according to plan. So in those cases, having an obsessive compulsive personality traits may actually be helpful for their craft to minimize any chances of making mistakes or issues or things like that. Although this can show up in other parts of life and the relationships and so forth. And so sometimes just being aware of these tendencies that one has can help one to be more cognizant of it, to sort of self-evaluate, to change it. But other times there are medications that can help decrease some of the tension or anxiety that may come with that. Even though it's necessarily FDA approved for obsessive compulsive personality disorder or traits, oftentimes psychiatrists will recommend like small doses of SSRIs like fluoxetine, Prozac, Lexapro, Zoloft to help with some of that tension or anxiety or anger that may come when someone's schedule is sort of different than what they're used to having.